everyone.
Hi, Andrea.
Hello.
If you can hear me.
Hi, Andrea. Can you hear us?
Yes, I can hear you now. Can you hear me okay?
Yes, we can.
Okay, perfect. Do you want me to introduce myself?
I did a brief introduction, but you can continue.
Okay, sorry, I didn't hear you at all. Introduce me. Okay, so I will get started. 1 second here. There we go. You can see my screen all okay?
I can, yes.
Okay, perfect. Excellent. Okay. So it's a pleasure for me to be here today speaking with everyone about scoping reviews. I will be doing some check-in questions as we go along. Can I just ask for everyone to mute themselves because there's a lot of background noise and I'm having a really hard time hearing people. So if everyone can mute themselves, there will be some quick check-in questions as I go along, as well as time for some more questions at the end. Okay. So in terms of conflicts of interest, I have none to declare. And today, I'm hoping that we'll be able to learn together the difference between systematic reviews and scoping reviews, the difference in the methods between scoping reviews and systematic reviews, as well as differences in reporting scoping reviews and systematic reviews. And then I'll present a few case examples of scoping reviews that were conducted by me and my team, and these were used to inform decision making. Sorry, can everyone please mute themselves? There's a lot of background noise. I'm not sure if the organizers can mute everyone. Thank you. So in terms of the differences between systematic reviews and scoping reviews, so just want to note that there are many, many different types of knowledge synthesis. So if you look at different typologies, there's that have been published in the literature, there's between 12 to 15, up to actually 20 different types. But today what we're going to be doing is we're going to be focusing on systematic reviews quickly and then scoping reviews. So a systematic review uses systematic and explicit methods to identify, select, critically appraise, extract, and analyze data from relevant research. So this is the definition from the Cochrane collaboration that I'm sure everyone is quite familiar with. In terms of a meta-analysis, this is what we do when we statistically pool the results from more than one studies. And we say that because we have a lot more data from patients and multiple studies, then we have more power to detect a difference should one exist. So now when we're thinking about a scoping review, according to the Canadian Institutes of Health Research, scoping reviews are exploratory projects that systematically map the literature available on a topic, identifying key concepts, theories, sources of evidence, and gaps in research. So if you're wondering why would you do a scoping review? So if you're interested in the extent, range, and nature of the available research on a topic or question, to determine the value of undertaking a full systematic review, to summarize and disseminate research findings across a body of research evidence that is heterogeneous and or complex, as well as to identify research gaps in the literature to aid planning and commissioning of future research. So when we think about a scoping review, you could see that some of these reasons that we would do it are much broader than a systematic review. So a systematic review, we're often focusing on a more specific question. And oftentimes we're thinking about the effectiveness or safety of an intervention, and we're getting to more hypothesis testing when we're doing our systematic review and meta-analysis. However, with a scoping review, it's a lot broader, and we're actually doing more hypothesis generating and just trying to chart the literature that has been done in the past. So we conducted a scoping review and included 494 scoping reviews. And the most common reasons that the researchers conducted their scoping review was to explore the breadth or extent of evidence, or to map and summarize the evidence, to inform future research, or identify and address knowledge gaps. So those were the most common reasons that researchers would do a scoping review. So we've done scoping reviews to help clarify working definitions and conceptual boundaries of a topic. When a body of literature has not been comprehensively reviewed, maybe it's complex, it's very large, it's heterogeneous. So those are to name a few different reasons why we would also consider doing a scoping review. Just so that, a quick check-in so that we're clear. So you would do a systematic review for a very specific question and often focus on the PICOS criteria. So that would be the patients, interventions, comparators, outcomes, and study designs. Whereas for scoping review, it would be a lot broader, and often we focus on participants, the contents, and the concept. So a little bit of a different framework for thinking about our scoping review question, and they're much broader. So just wanted to note that the Joanna Briggs Institute manual has a whole guide on how to do a scoping review. I'm currently the convener for the Joanna Briggs Institute scoping review methodology group. So we are in the process of updating this chapter on scoping reviews. So this hopefully will be published by the end of the year, where we'll have some more updated information on how to conduct your scoping review. Currently, I don't believe Cochrane has a chapter in the handbook on the conduct of a scoping review. So in the meantime, you can definitely use the Joanna Briggs Institute Reviewer's Manual. And the scoping review is a very common type of knowledge synthesis that is conducted by the Joanna Briggs Institute. So we'll all be familiar with the systematic review steps, but I just want to outline how these may differ slightly for scoping reviews. So we start with our protocol, and we want to use the preferred reporting items for systematic reviews and meta-analysis for protocols. We want to register it, whether it's with the Cochrane Library, whether it's with Prospero, whether you want to use the Open Science Framework, and you may publish your protocol if you wish. Then you do a comprehensive search of at least 2 or more databases. We peer review the literature search using the press statement, and you may also want to search for difficult to locate or unpublished, otherwise known as gray literature, as well as scan the references of included studies and relevant reviews to your topic. Title and abstract screening is recommended to be conducted by 2 researchers independently. They may meet to resolve discrepancies, and you may involve a third party if necessary. And this is followed by the full text screening of the potentially relevant articles. And again, this is conducted using the same format. For data abstraction, we use a predefined standardized data abstraction form. This is pilot tested amongst the team. When we have high agreement and everyone understands what we're supposed to abstract, then we have 2 people independently abstract all data. Discrepancies are resolved through discussion, or we have a third party resolve those. And then the same thing goes with the risk of bias appraisal. So we want to do a pilot test, make sure everyone knows how to do this, and then we use validated study design specific assessment tools. And sorry, I'm hearing a little bit of background, so if everyone who's not talking can kindly mute themselves, would be greatly appreciated. And then our data synthesis, it could be a quantitative, so meta-analysis when we're pooling everything. The synthesis based on the totality of evidence, but also want to note that we could potentially do a qualitative evidence synthesis as well. So in terms of the scoping review, so how does it differ slightly from a systematic review? Well, we still want to have our protocol, right? So even though it's a scoping review, we always start every knowledge synthesis with a protocol. So some nuances is that you're going to have very broad research questions. You likely won't be using the PICO framework, but you might be using the PCC, like I mentioned, population concept context. And then the Prospero database doesn't register scoping reviews, so you can register these with the Open Science framework. And you can also publish your scoping review protocol if you wish. Again, we want to make sure that you do a very comprehensive search, so your scoping review is only as good as your literature search. So we would use the same guidance as a systematic review for a scoping review for your literature search. And the same thing would be for study selection, so the same process. Instead of data abstraction, we call it data charting because we're really trying to chart how the literature has been broken down and how it's been reported. And so we're not abstracting, sometimes we're not even actually abstracting results in a scoping review. We're just charting, how many studies have looked at these patient populations, how many of them have looked at these concepts, what were the context of the studies, and we may or may not wish to abstract the results depending on what your objective is. Sometimes you're just interested in charting all of the outcome measures that have been examined in the literature, for example. So it's a little bit of a different terminology. However, the process is very much the same. We actually don't conduct risk of bias appraisal for a scoping review. And this is because we just want a snapshot of the literature and what has been done before. However, perhaps your research objective for your scoping review is to know not only what the literature is out there, but also what the quality is. Then that's a step that you could potentially consider. However, it's not commonly conducted for scoping reviews, likely because you actually identify a lot more studies out there than you would include in a systematic review. Sometimes it's not even studies, so the unit of analysis, we've done scoping reviews where we've included internet sites and blogs and media hits or media releases. So sometimes it's a different unit of analysis as well. And let's say if you are focused on studies, you may include many different studies out there, so it'd be challenging to appraise the quality or risk of bias for all the different study designs. So generally, we don't do risk of bias appraisal. And then in terms of data synthesis, we do not conduct a meta-analysis because it's not a focused enough question, right? So we could do a scoping review to determine areas for a systematic review, and then we would move on to the systematic review and meta-analysis. So it's generally not recommended to do a meta-analysis on a scoping review because it's just a broader type of research design. You can synthesize your information descriptively. You may want to do a formal qualitative analysis, so you may want to do some grounded theory or thematic analysis, depending on what your objectives are for your question. The synthesis is often focusing on charting the evidence and identifying data gaps. So I'm going to do a quick check-in. If we can turn the annotation on. Do I have to do that from my end, or how would I turn on the annotation?
Andrea, you can do it on your end.
At the bottom.
At the bottom. So is it under, oh, here, the pen, is that the one?
That's the one.
Yeah.
Okay, so everyone has access to the pen at the bottom, right? So if everyone can annotate and let me know if you were doing a scoping review, should you conduct a meta-analysis? So if you can, are people having problems with that?
It looks like it.
Okay, so for some reason this doesn't seem to be working. Oh, wait a minute. Okay, it's saying that, okay. So
now we can
it says now it should be able to work. So I've turned it on. Okay, perfect.
You can see it. Thanks.
Okay, we can see it. Yeah. Okay, perfect. Oh, sorry, I don't think people heard me there. Okay, so when we're doing a scoping review, so everyone is right, you're likely not going to be appraising the risk of bias, depending on your objective. So you may have an objective where you want to do this, or maybe your knowledge users or decision makers that you're working with want you to do this, but in general, we don't conduct a risk of bias appraisal. Okay, so I'm going to turn this off for now. And let me see if, okay, so I don't know how to get rid of this now. Is everyone still seeing all the annotations?
Yes, we can see them.
Do you know how I get rid of that?
Have you switched it off?
I switched it off, yeah. Yeah, I guess that this is not a great function on this. Okay. Let me see. Yeah, for some reason, this is not working. Okay. So I don't know. Does any of the conference organizers know how I can delete this? Maybe if I escape and come back? No. For some reason, this is still there.
I wonder. And
Yes, we move forward.
no,
Yeah. Okay. Well, something for you guys to figure out for next time if someone wants to use that function.
maybe we should take. How do we take control again?
Oh yeah. Maybe do you want to take control and then come back to me? Okay.
How did we do
You would
that?
have to give us control.
Mm-hmm.
Okay.
And screen.
Then go. Here we go dump it. Oh, why is this up?
It's depending on what you want to share now.
Oh, we didn't want to take the screen. We just want to, okay. So we need to
So change it back to there you go.
Okay. Perfect. Okay. So that's how we would do it.
Thanks. So Andrea, just to say, so next to all those pins that you click on, there's also a little button where you can delete what's on there.
Oh, race all drawings. I see it now. Okay. Thank you so much. I see it now. Okay. So let me get back to where I was because I wanted to do a little quiz and it will be people thinking in their heads. Whoops. Okay. So 1 second here. Okay. Oh, for some reason that went through. Okay, so basically where I'm at now is, okay, I was just going to do a quick check-in. So if I was asking what is the efficacy, effectiveness, and safety of herpes zoster vaccines in adults aged 50 and older? So when you're thinking about, is this a scoping review or a systematic review? It's a very, very specific study question. So it's going to be a systematic review. However, if I'm thinking about what are all the interventions that can ever be conducted to prevent and manage bullying in professional settings, this is going to be a scoping review because it's just a much broader research question. If someone's asking a question, what is known in the existing literature about mental health issues among immigrant and refugee youth in Canada? You can see this is a very broad research question. So we would likely be doing a scoping review. And then if we were interested in the effectiveness of different compression to ventilation methods for CPR, again, very, very specific. So this would be a systematic review. So just to get people thinking about, you know, if it's very specific, it's likely a systematic review. And if it's broader, it's likely a scoping review. So when we're thinking about the reporting of systematic reviews versus scoping reviews, there are some differences as well. So for scoping reviews, we have the PRISMA extension checklist. So this was published in 2018 in the Annals of Internal Medicine. And how this actually differs from the original PRISMA checklist is that the PRISMA for scoping reviews has fewer items. So we only have 22. And it doesn't have summary measures or additional analyses, or risk of bias and additional analyses in the results section. So that makes sense because, as we mentioned, for scoping reviews, we typically don't conduct any meta-analysis or quantitative synthesis, and we typically don't do risk of bias or methodological quality appraisal. So those are some differences between the reporting items. I do want to note that the original PRISMA statement is in the process of being updated by Dr. Matthew Page. So it will likely be quite different from the original ones. So because this is an extension for PRISMA for scoping reviews, then that will be something for us to consider in the future. So just a quick check-in. So when you're conducting and reporting a scoping review, should you be using the Joanna-Briggs manual, and you should also be using the PRISMA scoping review checklist. So just a quick check-in. So when we're doing a systematic review, we would often be using the Cochrane handbook, using the chapter, actually the whole handbook on doing a systematic review, and we would report it using the PRISMA statement. But then if we're doing a scoping review, we would use the Joanna-Briggs manual, and we would do the PRISMA scoping review extension checklist for reporting it. So now I will move on to some examples of scoping reviews that my team has conducted. So one was on the prevention and management of unprofessional behavior among adults in the workplace. So what we found is that there were 4 constructs of unprofessional behavior, so verbal and or nonverbal acts, repeated acts, power imbalance, as well as unwelcome behaviors. And we found that 96% of studies had interventions for individual level behavior change versus changes at the institutional level. And most of the studies were trying to increase awareness about the behavior versus trying to make any changes with the behavior. Most of the target behavior change was on sexual harassment, which the studies found to be the most problematic. And 83% of studies had interventions delivered as in-person educational sessions versus online or computer-based types of sessions. So in terms of the impact, our results can be used to inform professional interventions in the workplace. And this was commissioned by the Department of Medicine at the University of Toronto, and this was trying to enhance professionalism in the department. So our results were used to develop interventions by the Department of Medicine at the University of Toronto when it comes to professionalism in the workplace. Another scoping review that we did, this was on social media and crowd intelligence data for pharmacovigilance. So we found that common social media data sources were mostly Twitter, as well as these other ones listed here. We found that this field was in its infancy, and it has a potential to help with regulatory agency databases, so it can capture less frequently reported adverse events, as well as identify adverse events earlier than official alerts. However, the utility and validity of the data sources is understudied. So we conducted the study for Health Canada. So this is our regulatory health agency in Canada. And this was to provide information on the validity and reliability of using social media data for pharmacovigilance. So this would be patients who are reporting adverse drug events through Twitter and other social media sources. And this is actually informing the conceptualization of a social media listening platform that might be used in Canada in the future. And another project that we worked on was how can we engage policymakers, health system managers, and policy analysts in the knowledge synthesis process. So this was a scoping review that was commissioned by the World Health Organization. So we found that policymakers, healthcare professionals, and government agencies and patients were the most frequently engaged knowledge user type in the knowledge synthesis process. And knowledge users were most commonly engaged during the data synthesis and interpretation phases. A lack of time or opportunity to participate was the most common barrier to engagement. And knowledge user content, expertise, and awareness was the most commonly reported facilitator. So perhaps members here that are on the line today are interested in engaging different knowledge users in your systematic review or in your scoping review, so you can use the results of our project to help inform that. And this was actually directly used to facilitate the engagement of policymakers in different teams that are in low-income economy countries. So we've been doing some work through the WHO with different centers across the world and trying to make sure that their policymakers are using evidence in their decision-making needs. So this would help inform those efforts. And it was also included in a chapter in our guide on rapid reviews to strengthen health policy and systems. And again, this was commissioned by the Alliance for Health Policy and Systems Research at the World Health Organization. Also, this is a protocol brief. So this is something that we do for all of our projects. So for all of our projects, we do we write the protocol, and then we also post a brief, so a quick one-pager on what our protocol is for people who may not have the time to read our entire protocol. And it's just a snapshot of what we intend to do with the project. And we post all of these online on our website, which is with the Knowledge Translation Program at the Li Ka-shing Knowledge Institute of St. Michael's Hospital. So this was a scoping review that we did. We had to do rapidly because we had a short time frame for this. And this was looking at the prevalence of gaming disorder. And this was commissioned by the World Health Organization. So basically, we were interested in gaming disorder because it is a new disease entity as per the International Classification of Disease. So we wanted to look at the literature worldwide and see what the prevalence is. So because it was quite broad, we used a scoping review. So basically, we found 160 studies on internet gaming disorder, but not on gaming disorder in general. There were 35 different ways of measuring internet gaming disorder, so quite a lot of variation in the definition and measurement. The countries, so most of them were conducted in Korea and China, followed by the US. And we found that the prevalence ranged quite widely, so from 0.32 to about 40% in general populations, from 3 to about 42% in clinical populations, and then from about 70 to 77% in very severe cases where they would be undergoing interventions. And so we recommended that some agreement or consensus is needed on the definition and standardization for internet gaming disorder. So in terms of the impact, so this was shared with the World Health Organization. It will also be made available on their website for public access, and this will help when they're refining their ICD code for this. And we're also going to be submitting our results to a peer-reviewed journal for publication, and then also has been shared with our Evidence Alliance, which is a Canadian-based initiative. And it's a strategic patient-oriented research alliance where we're basically trying to do knowledge synthesis, knowledge translation, and clinical practice guidelines for knowledge users across Canada. So in summary, scoping reviews are conducted to map the literature on a topic in a systematic way. So even though it's not a systematic review, we still want to use rigorous methods, and we still want to make sure that we are very transparent and that we conduct everything in a very transparent and reproducible manner. Scoping reviews are useful when an area of research is new or emerging, heterogeneous, and or complex. And when you're doing your scoping review, you can use the Joanna Briggs Institute guidance. Again, that will be updated later this year. And you can use a PRISMA for scoping reviews to report the results of your review. So hopefully we've been able to meet all of our learning objectives today. And just before I take a few questions, I want to acknowledge my funding from the Canadian Institutes of Health Research, as well as the Canadian Agency for Drugs and Technologies in Health. And also want to acknowledge my Tier 2 Canada Research Chair in Knowledge Synthesis. Want to thank everyone that was involved in the development of the PRISMA extension to scoping reviews. And also wanted to thank Nazia for helping develop the slides that were presented today. So thank you so much for your attention. I think now we have quite a bit of time to answer some questions. So in terms of moderating the questions,
hi Andrea, I'm here.
Hi.
Hi, so I've got some questions that people asked in the chat box.
Oh, perfect. Do you want to read those to me?
Yeah, sure. So the first one is one person didn't hear the difference between a scoping review and a systematic review. Maybe you can briefly touch on that.
The difference between a scoping review and systematic review?
Yeah, maybe just briefly talk on that.
Okay, so I think that was covered in the first part of my presentation, but basically a scoping review is going to be much broader. You won't be doing the risk of bias or quality appraisal for the most part. And you would be using the Joanna Briggs Institute Guide for the conduct, as well as a PRISMA extension to scoping reviews for the reporting. Whereas for a systematic review, it's a very specific research question. You may be considering doing a formal synthesis, such as a meta-analysis or qualitative evidence synthesis. You would definitely be doing the risk of bias or methodological quality appraisal. You would use the Cochrane handbook for systematic reviews for the conduct. And you would use the PRISMA statement, the original one, for the reporting.
Great, thank you. A second question, the person asks, where would scoping reviews lie in the hierarchy of evidence?
So I think scoping, that's a great question. So I think a scoping review is more of an exploratory or hypothesis generating type of project. So I haven't seen it on the pyramid, but it would be probably down with studies like observational studies where you're just trying to do hypothesis generating type of work. But that's a great question.
Thanks. And then another question, the difference between scoping review and overview of reviews.
Yes, so an overview of reviews would be only including reviews, whereas a scoping review could be including many different types of studies, and the unit of analysis might not even be a study for a scoping review. Whereas for an overview of reviews, the unit of analysis will always be a review and most likely a systematic review. And also for an overview of reviews, it's likely a more specific question based on the PICOS component for the most part, whereas a scoping review will be quite broad and you would be using something like the population concept and context versus a more specific research question.
And then another question that I've got is whether a scoping review and evidence maps, are they similar or the same?
I would consider them to be quite similar, so agree. I think, you know, you could do a scoping review and present a map. I think they both are trying to chart where the evidence has been conducted. So perhaps for an evidence map, that would be the main focus. So the literature, where it's been conducted internationally, whereas for scoping review, you can have other objectives, but you could absolutely have that as one of them. So I would say they're absolutely related.
Okay, thank you. And then another question, does JBI and PRISMA not consider ASCII and O'Malley to report?
Pardon me?
So does JBI and PRISMA, does it not consider ASCII and O'Malley to report?
So ASCII and O'Malley, that was a seminal paper that was published in 2005, which actually introduced the method of a scoping review. And I would say that absolutely that, that's the seminal paper introducing it. And then the JBI guide would follow that quite closely, but then would just do further refinement and provide more information and more details. And the same as a PRISMA for scoping reviews for reporting. I don't think that the ASCII and O'Malley went into great detail on how to report your scoping review. It was just mostly introducing what a scoping review is and how you do it. So I think that although the PRISMA extension would be consistent with it, it's focused more on reporting, whereas the ASCII and O'Malley was more focused on introducing that concept and introducing that method and talking about how to do it.
Thank you. Another two questions. Some participants would like to know the difference between rapid reviews and a scoping review, and also a scoping review and a literature review.
Right. So, yeah, perfect. Sorry, was there anything else? So the difference between a rapid review, scoping review, and lit review?
Yeah.
Yeah, so a lit review wouldn't have any methods, right? It's just basically trying to do something, where you're searching the literature and seeing what has been done before, and you may not use any methods, right? You just summarize the few papers that you come up with. A rapid review, that can be done for most of the different knowledge synthesis. So you could do a rapid scoping review, you could do a rapid systematic review, you could do a rapid realist review. So that's when you're trying to methodologically tailor the conduct of your review according to your knowledge user needs. So these are often projects that are being conducted for decision making, and the decision making needs to be made quite quickly. So in order to do that, we have to streamline our methods to produce timely results. So most of the methods that we do, we can actually do them rapidly, except for some qualitative evidence synthesis where it's more inductive and you're kind of coming from the ground up and coming up with key concepts and theories and frameworks. And for those types of projects, it may be challenging to do a rapid knowledge synthesis because it just takes a lot of, it's very iterative and there's a lot of thought. You need time to think closely about all of those issues. So for some types of qualitative evidence synthesis, a rapid review may not be amenable for that. However, you could do, even now we're doing some work, some of my colleagues in Madrid are leading some work by a lady named Ingrid. She's leading a whole series of projects on rapid diagnostic reviews. So there's lots of different types of rapid knowledge synthesis that you can conduct. And if people are interested in the differences between overview reviews, rapid reviews, systematic reviews, we have a paper that was published in the Journal of Clinical Epidemiology that's called Same Family, Different Species, where I talk about the differences between 5 different types of knowledge synthesis that can be used for interventions. So that might be of interest to people.
Thank you. I think I've got one last question over here. The person asks, if I have a specific research question but find that there is very little literature out there and the available studies do not allow for me to conduct a meta-analysis, can I call it a scoping review?
Sorry, can you repeat the start of that?
So if I have a specific research question but find that there's very little literature out there and the available studies does not allow for me to conduct a meta-analysis, can I call it a scoping review?
Okay, that's a really great question, and the answer would be no. You don't just call something a scoping review based on your results. You actually need to decide at your research question protocol stage, are you going to do a systematic review or are you going to do a scoping review? It has no difference on what results that you find. So if you have to say, what is your objective and what is your research question, and then determine based on that what your study design is going to be. Right, like it would be the same thing, like if you're trying to do a randomized trial, but you don't find a lot of patients, then now I'm going to do a cohort study. Well, probably your research ethics board wouldn't allow that, right? So you want to make sure from the start, this is what I'm intending to do, right? So when you register your protocol and everything else. Now, let's say you're planning to do a systematic review with a very few, very focused research question, and you don't find many studies, you still call that a systematic review and you still publish that as a systematic review.
Okay, thank you, Andrea. I do not see any other questions really coming up.
Okay, I do see one here from Peter Hodgkinson saying that I worry the limitations in LMIC settings where there's not a lot of research out there. So they tend to rely on high income country outputs. I don't know if you see that question.
Okay, yeah. I think.
Yeah. Yeah, so I think that's a really great point. So and I agree. Like a lot of times, the literature is on high income settings. So I think you can still do, if you're doing a scoping review, you can try to include all the international literature and then see if there's some items, some components of that particular context for some of the research that would be relevant to your setting. So sometimes, even though it's conducted in a high income country, there may be an area where, you know, that context might be similar to yours. So I agree, like it is a problem, and it is difficult when, depending on which topic that you're focused on, that there might not be a lot of literature in LMIC. So my suggestion to that would be to try to use the results that you have and see if there's something in there, any little nugget of information that you can use that you can apply to your context. So hopefully that's helpful. Someone asked about my slides being available, so I'm happy to share them as a PDF, so I can share those afterwards.
Yeah, so you can send it to us and we'll send it to them.
Okay, and then someone asked to go back to the slide for the different process of a scoping review and a systematic review. I think we have some time. Are we able to do that?
Sure, yeah.
Okay, I just wanted to allow for a lot of time. That's why I didn't put a lot of slides, because I wanted a lot of time with discussion. So basically, this is from Wendy Geza. So thanks for your question, Wendy. Let me find that slide. This one. Okay. So basically, if you see the funnel here, right? So all of the steps so this funnel is, sorry, let me just show you. This funnel is the same funnel for systematic reviews. Okay, so the only difference, so this is systematic review, which we're all familiar with, right? So the only differences are, for a scoping review, you're always going to start with a protocol, right? But instead of using the specific PICO framework, you're likely going to use a broader framework, such as the population, concept, and context. Okay, so, and that's what the Joanna Briggs Institute recommends. So you're going to use a broader research question. For your protocol, you cannot register it with Prospero. They do not accept scoping reviews. So you're going to likely register it with something like Open Science Framework. So that's one big difference. The search will be the same. Study selection will be the same. Data abstraction will be the same, except that we call it data charting, and you may or may not be charting the results. It depends on your research question. We do not conduct risk of bias appraisal for scoping review or methodological appraisal for the most part, because we just want to know what has been done and have a snapshot of the literature. And then for data synthesis, we're not going to be conducting a meta-analysis because we're just focused on very broad, very broad results, and basically the charting results, right? So we don't do a meta-analysis for a scoping review. Another big difference as well is that for a systematic review, we can make policy or practice recommendations, whereas for a scoping review, we can't, right? So for a scoping review, we can talk about a future research agenda or future studies or data gaps for practice or policy recommendations, but for a scoping review, we can't make those recommendations because it's just been a very broad research question. It's not specific, so we can't provide specific recommendations with a scoping review. So that was a really fantastic question.
Thank you. Another question that has come up a few times is, can you further explain the PCC framework?
Yeah, so yeah, that's a great question. So that one, so that's listed right here. So the PCC stands for population, the concept, and the context. So your concept is kind of thinking about what the topic is, that the very broad topic that you're interested in. And then the context would be, you know, it could be a healthcare setting. So are you interested in, you know, within a clinic or a hospital, or is it a community-based type of thing? Or is it within low-income economy countries versus high-income countries? So thinking about anything related to the context that you're interested in. So the P for population would be similar to your PICO. The concept, it could be an I for intervention, depending on what topic that you're interested in. You can absolutely do a scoping review on interventions, and then your context would be providing a bit more information into, you know, where is it being conducted? So is it a different setting thing? Perhaps, you know, it's focused on a specific environment, a specific area. It could be, you know, it's kind of getting into the setting or where these studies were conducted for the context. There's more examples if people are interested for the PCC. So if you go online, you can get the Joanna Briggs Institute Reviewer's Manual for Scoping Reviews online, freely available. And they go through really nicely a lot of examples of different research questions and how this can be broken down.
Thanks. And another question, can we consider that systematic reviews are more difficult than scoping reviews?
I love that question. I don't know. I mean, it depends, I guess. More difficult. How do we define more difficult, right? So a systematic review, you have your risk of bias and potentially a meta-analysis. So those are extra steps that you may not take in a scoping review. But in a scoping review, you may be including many, many more studies, right? So, and then trying to chart it and trying to summarize it and describe the literature can be, and present the results could be a little bit of a challenge as well. So it depends on, you know, who you are and where your expertise is. I mean, for me, I don't see any differences between doing a scoping review and a systematic review, but maybe it's because I'm quite familiar with the method. So that would be another thing. If you're not very familiar with scoping review, maybe the first or second time you do it might be a bit more challenging if you're more familiar with a systematic review. So I would say like they're about the same, but they just have different things that you have to consider.
Okay, thank you. Another question. Regarding the charting of data, do you mention the study types that are identified?
Oh, sorry, can you repeat that? I didn't hear that clearly. Sorry about that.
Charting of data, do you mention study types that need to be identified, or types of studies? Do you identify them?
Yes, so for in your protocol, you want to talk about what type of study designs would be of interest. Maybe it's not a study design, maybe it's other kinds of documents that are of interest. So you definitely want to define that all up front. And then when you're charting, you absolutely would chart and say, you know, 10 of them were randomized trials, 20 of them were cohort studies, 5 of them were case series, 3 of them were qualitative interview studies, 2 were focus groups. right? So you would definitely want to report and characterize the literature according to what type of study that it was or what type of document. So it could be, you know, how many were, for example, with ours on social media platforms, so how many were from this platform, how many were blogs, how many of them were, you know, just internet websites, how many were discussion groups. So you would chart all of that.
Thank you. Another question, can we consider scoping reviews like qualitative research for knowledge synthesis studies?
Can we consider a scoping review as a qualitative research or a knowledge synthesis?
Like qualitative research for knowledge synthesis studies.
I mean, you can still do. So that's an interesting question. So for a scoping review, you can do a thematic analysis in a scoping review. I would say it's more like an exploratory type of research. You could still also summarize the numbers. Like for our internet gaming disorder, you saw we did prevalence. That's numeric. That's not qualitative. That's quantitative, right? So I would consider it to be more consistent with exploratory study designs when we're comparing it to epidemiology as an example. So it would be maybe you could consider it as like a cohort or a cross-sectional. Cross-sectional might be the best because it's kind of a snapshot of the literature in time. So I would classify it more as being observational versus saying whether it's qualitative or quantitative. It could be quantitative, it could also have qualitative elements.
Okay, thanks, Andrea. I'm not sure if you are seeing any other questions.
I see this one question here. Maybe this will be the last one that was answered a while back, where it says, this is from Ryan Walker, and he's asking, are there any issues with using software such as deep web search software to return results that include e-learnings, protocols, tools, videos on a topic instead of established traditional search strategies, which would only return published literature on a research question? So that's a great question, and I think more and more people are thinking about alternatives. So there was just a paper recently that I tweeted. I can't remember. I'd have to look through my Twitter feed to find it, but it was quite cool in trying to talk about different ways of searching than the way that we've been doing it. So I think these are really exciting things to think about and exciting methods. However, they haven't been validated. So I think before, you know, the systematic review or the knowledge synthesis community embraces these types of methods, we would have to show how valid and reliable that they are to make sure that, you know, we're not missing important information. So that's where we would call upon, you know, graduate students and the younger folks who have a lot of energy to go through those different methods. And I think in order to convince people, they're going to have to, you know, do some more work on convincing us that it's valid and reliable, those methods.
Thanks, Andrea. I think one last question for today. In overview of reviews, what happens if you are trying to synthesize evidence from Cochrane and non-Cochrane reviews, and you come across two studies that looked at the same intervention? One is a Cochrane and the other is non-Cochrane. Do you consider both? If not, which one takes priority?
Okay, so this is in a scoping review or an overview of reviews? Or both? Any type of knowledge synthesis?
So it says in overview of reviews.
Okay, so I think that I thought that in an overview of reviews, you include all the reviews, regardless of whether they're Cochrane or non-Cochrane. I mean, I think the majority of published systematic reviews are not Cochrane. So you would probably want to summarize all of the reviews. And then often what we do for our knowledge users, because sometimes when we do overviews of reviews, they're very broad. So what we would do is we would include all the reviews, systematic reviews. We would summarize all their findings. We would appraise their quality. So we would use the Robbie's tool or the AmStar2 tool to appraise the risk of bias in those reviews. And then we would tell our knowledge user for this specific question that, for this specific intervention, this specific comparator, this outcome, that the highest quality systematic review was this one, whether it's Cochrane or non-Cochrane. So although Cochrane reviews are known for their being the most methodologically rigorous ones, there may be a really well-conducted non-Cochrane review out there as well. So my advice would be to include them both, synthesize them both, appraise the risk of quality, and let your knowledge user or decision-making partner know that which one that you would trust the results more of.
Okay, thank you very much, Andrea. I think those are all the questions for today.
Perfect. I'm just going to put up my email again. I know that you guys have it on the worksheet or the advertising materials, but if there are any other questions that come in afterwards, feel free to send them to me anytime, or people can email me anytime. I'm happy to take questions, and this is obviously a field that I'm very passionate about, and we do a lot of different projects, a lot of different types of knowledge synthesis for knowledge users or decision makers, so happy to answer any questions or collaborate with anyone in the future.
Okay. Thank you very much, Andrea.
Thank you so much.
So for the next webinar, which will happen on the 14th of May, the topic will be priority setting using the Spark tool. And we'll be sending out a communication shortly. Okay, thank you very much again to Andrea Tricco for a lovely presentation. As she mentioned, you can email her. The email's on your screen if you have any more questions that come to mind. Thank you, everyone.
Bye. Thank you. Thank you. Thanks so much.
Thank you, Andrea.
Thank you.
Thank you.
Bye.
Bye now.
Thank you.